One of the most common causes of chronic kidney disease is hypertension. In hypertension, the walls of arteries supplying the kidney start to thicken in order to withstand the pressure, and that results in a narrow lumen. A narrow lumen means less blood and oxygen gets delivered to the kidney, which leads to ischemic injury to the nephron's glomerulus. Immune cells like macrophages and fat-laden macrophages, called foam cells, slip into the damaged glomerulus and start secreting growth factors like transforming growth factor beta 1, or TGF beta 1. These growth factors cause the mesangial cells to regress back to their more immature stem cell state known as mesangioblasts, and then those mesangioblasts secrete extracellular structural matrix. This excessive extracellular matrix leads to glomerulosclerosis, which is hardening and scarring, which diminishes the nephron's ability to filter the blood. And over time, this leads to chronic kidney disease. The most common cause of chronic kidney disease is diabetes. In this situation, excess glucose in the blood starts sticking to proteins, a process called non-enzymatic glycation, because no enzymes are involved. This process of glycation particularly affects the efferent arteriole and causes it to get stiff and more narrow, a process called hyaline arteriosclerosis. This creates an obstruction that makes it difficult for blood to leave the glomerulus, and increases pressure within the glomerulus, which leads to hyperfiltration, essentially pushing more fluid through. In response to this high-pressure state, the supportive mesangial cells secrete more and more structural matrix, which expands the size of the glomerulus. Over many years, this process of glomerulosclerosis once again diminishes the nephron's ability to filter the blood and can lead to chronic kidney disease. Although diabetes and hypertension are responsible for the vast majority of chronic kidney disease cases, there are other causes as well, including systemic diseases like lupus and rheumatoid arthritis, which can also cause glomerulosclerosis. Other causes, though, include infections like HIV, as well as long-term use of medications like NSAIDs, and toxins like the ones in tobacco. Now, normally, urea in the blood gets excreted in the urine, but when there's a decreased glomerular filtration rate, less urea gets filtered out, and therefore it has nowhere else to go besides the blood, and so it builds up in the blood, which is a condition called azotemia. Azotemia can cause general symptoms like nausea and loss of appetite, but as urea levels really build up, they can affect the functioning of the central nervous system, causing encephalopathy. This results in asterixis, a tremor of the hand that kind of resembles a bird flapping its wings, and is best seen when a person attempts to extend their wrists. Further accumulation can even progress to coma and death. This buildup can also cause pericarditis, which is inflammation of the lining of the heart. In addition, there can also be increased tendency for bleeding, since excess urea in the blood makes platelets less likely to stick to each other, and so there's less clot formation. Finally, in some cases, someone can develop uremic frost, where urea crystals can deposit in the skin and they look like powdery snowflakes.